For most people, the feet are the most forgotten part of the body. They carry you faithfully through every single day of your life. Across your lifetime, they cover thousands of miles, yet you offer them almost no attention until something goes wrong enough to demand it. For someone living with diabetes or someone who has it and remains unaware, this neglect carries heavy consequences. The feet are among the first places where diabetes reveals itself most clearly and diagnostically. The signs are obvious to anyone who understands what to look for, meaning these conditions can be caught early when intervention matters most. That is, provided the person examining their own feet actually knows what they are seeing. Today, I want to guide you through 10 specific foot signs that indicate diabetes or its emerging complications. Some of these signals might already be familiar to you, while others may genuinely surprise you. All of them are essential to know, whether you have already received a diagnosis or simply suspect you might be at risk. The first system involves the small nerves distributed throughout the body. Prolonged high blood sugar damages these nerves in a condition known as diabetic neuropathy. Because the longest nerves in the body extend all the way down to your feet and toes, they are usually the first to suffer. This is why so many early complications surface in the feet long before appearing anywhere else. The second system involves the small blood vessels. High blood sugar damages these vessels, drastically reducing circulation to your extremities. Because your feet are located farthest from your heart, they are exceptionally vulnerable to this reduced blood flow. The combination of damaged nerves and compromised blood vessels produces a very specific set of physical changes. Taken together, these symptoms form a virtual diagnostic map. A skilled clinician can examine a patient's feet and immediately gather vital information about how long diabetes has been present, how well it is controlled, and what complications might be developing. What I want to share with you today is the patient version of that exact skill. I want to empower you to inspect your own feet with informed attention, recognizing what is normal, what is not, and when to seek medical help. Are you ready? Let us walk through the 10 signs together. The first sign is numbness, tingling, or a burning sensation in the feet or toes. This represents one of the earliest and most common indicators of diabetic nerve damage. It typically begins in the toes before gradually spreading upward toward the foot and lower leg over time. Doctors refer to this progression as a stocking distribution because it mirrors the area a sock would cover. The physical sensation varies considerably from patient to patient. Some people describe a persistent tingling, similar to the pins and needles feeling when a foot falls asleep, except it never goes away. Others experience a burning sensation, particularly at night when they are trying to rest quietly. Many report complete numbness, a strange feeling that their feet are no longer communicating properly with the rest of their body. Some describe feeling as though they are always wearing thick socks while barefoot, walking on cotton balls, or needing to tread far more carefully than before. This symptom is critical because it signals that active nerve damage is underway. For an undiagnosed individual, the onset of these sensations offers a major clue that blood sugar has been elevated for a while. For a diagnosed patient, these symptoms indicate that complications are developing and that tighter blood sugar control is urgently required. If you experience any of these sensations in your feet, please schedule an evaluation with your doctor. Blood tests can quickly confirm diabetes, while a thorough physical examination can document the extent of any nerve involvement. Catching this early prevents far more severe complications down the road. The second sign is a complete loss of sensation in the feet. This represents the next stage of nerve damage, and in many ways, it is far more dangerous than tingling or burning because it produces no active symptoms to warn the patient. The nerves simply stop transmitting signals altogether. The underlying danger here is that the foot can no longer detect pain, temperature, or pressure normally. A small cut goes entirely unnoticed. A pebble inside a shoe remains unfelt, a painful blister forms and expands, or a hot bath scalds the skin without the person ever realizing it. The natural protective sensation that keeps your feet safe is effectively gone. You can test for early sensory loss yourself using a very simple method. Close your eyes and run a finger lightly across the skin of your foot and toes. You should be able to feel that gentle touch clearly. If the feeling seems muffled, if certain areas feel less sensitive than others, or if you cannot feel the touch at all, you need to inform your physician. The standard clinical evaluation for sensory loss uses a thin nylon strand called a monofilament, which is applied to specific points on the foot. If you cannot feel the filament at those key locations, significant loss of sensation has occurred, elevating your risk for foot complications. Your doctor can easily perform this test, and every patient with diabetes or suspected diabetes should receive it during routine checkups. The third sign is the presence of foot ulcers particularly sores that refuse to heal. A foot ulcer is an open wound or lesion typically found on the bottom of the foot or over a prominent pressure point. In diabetic patients, these sores often start from minor injuries that went completely unnoticed due to sensory loss or from tight shoes rubbing repeatedly against the skin. What makes diabetic foot ulcers uniquely dangerous is their inability to heal properly. The reduced circulation associated with diabetes starves the area of the blood flow needed for tissue repair. Meanwhile, diminished nerve function allows the patient to keep walking on the open wound, unaware of how severe it is becoming. To make matters worse, elevated blood sugar creates an ideal environment for bacteria to thrive. A diabetic foot ulcer is one of the most serious complications in all of diabetes care. Without immediate and appropriate medical intervention, these ulcers rapidly become infected, spreading into deeper tissues and even bone. In the worst cases, surgical amputation becomes necessary to control the infection. The risk of amputation among patients with poorly managed diabetes and chronic ulcers is substantial, making the prevention of these wounds a top priority. If you spot any open sore on your foot that fails to heal within a few days, consult your doctor immediately. This is not a condition to ignore or attempt to manage on your own at home. Early treatment by a clinician experienced in diabetic foot care can prevent the catastrophic cascade of complications that follows a neglected ulcer. The fourth sign involves noticeable changes in the color of your feet. Healthy feet generally maintain a soft pink tone, warming slightly when you stand and returning to their normal shade quickly if you press on the skin. Deviations from this standard pattern often signal circulatory problems triggered by diabetes. Feet that look unusually pale, especially when elevated, and turn a deep red or dusky purple when lowered suggest significant arterial disease. This condition, known as dependent rubor, proves that circulation is insufficient to keep the foot properly oxygenated in normal positions. Feet displaying bluish discoloration indicate poor oxygenation or broader vascular issues. Additionally, unexpected dark spots that suddenly appear warrant prompt evaluation. These spots can sometimes represent serious skin conditions, including melanoma, which can develop on the feet and often goes undetected because people rarely inspect their soles. If you observe any major changes in the color of your feet, particularly alongside other symptoms, bring it to your doctor's attention immediately. The fifth sign is a distinct change in foot temperature. Healthy feet should feel warm to the touch in a standard room environment. They might feel cool after being elevated or exposed to cold weather, but they should warm up again once you start moving around. Feet that remain persistently cold to the touch, even in warm environments, strongly suggest poor blood flow. For individuals with diabetes, this serves as an early indicator that arterial disease may be progressing. Conversely, a section of the foot that feels noticeably warmer than the surrounding skin or warmer than the same spot on the other foot can signal localized inflammation, an active infection, or a severe condition known as Charcot foot. This complication develops in patients with advanced nerve damage. If you notice consistent temperature irregularities, especially if one foot feels noticeably different from the other, inform your physician promptly. The sixth sign is an actual change in the physical shape of the foot. This sign often surprises patients because the idea of a foot altering its shape sounds unusual. However, in individuals with severe diabetic nerve damage, the structural integrity of the foot can deteriorate over time, altering how weight is distributed and how shoes fit. Charcot foot is a severe complication of diabetic neuropathy, wherein the internal bones weaken and fracture without causing any noticeable pain. Over time, the structural arch can collapse, resulting in an abnormal shape often called a rocker bottom foot due to its rounded sole. Other structural changes include hammer toes, where the toes curl downward unnaturally, as well as bunions or other deformities that worsen alongside diabetes-related shifts. If you notice your feet changing shape, your shoes fitting differently, or new bony bumps appearing, contact your doctor immediately. Charcot foot in particular is a medical emergency that requires swift intervention to prevent permanent, disabling deformities. The seventh sign appears as noticeable changes in the skin of your feet. Diabetic skin complications manifest in several distinct ways. The skin often becomes severely dry and cracked, especially around the heels, because damaged nerves stop sending signals to the sweat glands, disrupting natural moisture balance. Cracked skin creates an open entry point for bacteria, frequently leading to the dangerous ulcers discussed earlier. Over time, the skin may also take on a shiny, thin, paper-like texture, reflecting underlying changes in connective tissue and blood vessels. Calluses often develop more aggressively and prove harder to clear due to reduced healing capacity. Thick calluses over pressure areas can actually trigger ulcer formation by driving intense pressure into deeper tissue layers. Specific dermatological conditions associated with diabetes can also surface, such as diabetic dermopathy, which creates light brown patches on the shins. Another condition, necrobiosis lipoidica, produces reddish-brown lesions that can eventually break open into ulcers. Furthermore, localized skin infections, including stubborn fungal infections between the toes, occur more frequently and prove harder to eradicate in diabetic patients. Persistent athlete's foot or nail fungus that resists standard treatments often signals that underlying high blood sugar is compromising your body's immune defense. If you notice major changes in the skin of your feet, seek professional medical guidance, as many of these issues are easily managed when caught early. The eighth sign involves distinct changes in your toenails. Diabetes can alter toenail health in multiple ways, causing nails to become noticeably thicker, brittle, and yellowed over time. This occurs partly from diabetic tissue changes and partly because fungal infections thrive in higher blood sugar environments. Ingrown toenails also present greater risks, both due to the higher likelihood of infection and because diminished sensation prevents patients from feeling the early pain. Bleeding beneath the toenails, often appearing as tiny black spots, can result from minor trauma that a person with normal sensation would have felt immediately. In a patient with neuropathy, these minor injuries occur completely unnoticed. A primary concern is subungual melanoma, which can develop under the toenails just as it does under fingernails. A new dark line running down a toenail requires the exact same urgent evaluation as one found on a hand. If you spot significant changes in your toenails, discuss them with your doctor. Toenail issues in diabetic patients are never merely cosmetic. They frequently mark the beginning of far more severe foot complications. The ninth sign is weakness in the foot muscles or unexplained changes in your gait. This represents a less recognized sign, yet it remains critically important. The nerve damage caused by diabetes affects not only sensory nerves, but also the motor nerves that control muscular movement. Over time, the small intrinsic muscles within the foot can weaken and waste away, altering the structural foot shape and affecting overall function. Patients might notice their feet feel noticeably weaker, that curling their toes feels difficult, that their arch profile has shifted, or that their walking pattern feels slightly off. They may find themselves tripping more often, struggling with basic balance, or noticing that their feet slap the ground rather than rolling smoothly through a stride. These changes can be subtle, creeping up so gradually that a person adapts without realizing what is happening. However, they indicate ongoing nerve and muscle degradation that requires proper medical evaluation. If you have noticed shifts in how your feet feel while walking, changes in your balance, or a drop in foot strength, bring it up with your physician. The 10th sign is a foot infection, particularly one that develops without an obvious cause or proves unusually slow to heal. Individuals with diabetes are far more vulnerable to foot infections than non-diabetics for all the reasons we have discussed. High blood sugar creates an ideal feeding ground for bacteria, reduced circulation delays tissue repair, loss of sensation allows injuries to go unnoticed, and a weakened immune system struggles to clear pathogens. Any foot infection in a diabetic patient demands immediate clinical attention. This includes athlete's foot that spreads, fungal nail conditions, bacterial infections in small cuts, and cellulitis, a deeper skin infection that can spread rapidly. Warning signs that an infection is escalating include spreading redness, increasing heat, pus or fluid drainage, fever, worsening pain, or red streaks traveling up the foot or leg. Any of these symptoms requires emergency medical evaluation. For someone with diabetes, a foot infection is never minor. It can escalate rapidly, leading to hospitalization, intravenous antibiotics, and in severe cases, surgical intervention or amputation. Catching infections early and treating them aggressively remains one of the single most crucial aspects of diabetic foot care. Now, I want to pause and talk about prevention because identifying these 10 signs is only half the battle. The other half involves actively preventing them from occurring in the first place. The single most important preventative measure is consistent blood sugar management. The severe complications I have outlined develop predominantly in individuals whose blood sugar levels remain poorly controlled over extended periods. A patient who maintains good glycemic control, keeps their hemoglobin A1C within a target range, takes prescribed medications reliably, and follows dietary guidance drastically reduces their overall risk. Developing the habit of daily foot inspection is equally critical. Examine your feet every single day using a mirror to check the soles if flexibility is an issue. Inspect the spaces between your toes, searching for redness, sores, blisters, or any shift from the previous day. A patient who knows the daily baseline of their feet can catch subtle issues immediately when treatment is simplest. Daily washing and thorough drying are also fundamental. Wash your feet using mild soap and warm water, taking care to dry thoroughly between the toes, as trapped moisture promotes fungal growth. Apply a good moisturizer to keep the skin from cracking, but avoid applying it between the toes where extra moisture causes problems. Proper footwear makes an enormous difference as well. Individuals with diabetes should always wear well-fitting shoes that protect against impact and eliminate friction or pressure points. Going barefoot, whether indoors or outdoors, is strongly discouraged due to the heightened risk of unperfelt injuries. Toenail maintenance must also be handled with great care. Cut nails straight across, keeping them moderately long and avoiding rounded corners. If you struggle to reach or see your feet clearly, have your nails trimmed by a professional, ideally a podiatrist experienced in diabetic care. Avoid exposing your feet to direct heat sources. Never use hot water bottles, heating pads, or scalding bath water on feet with reduced sensitivity, as severe burns can occur without you feeling them. Finally, routine professional evaluations are essential. Every diabetic patient should have their feet checked during routine medical visits and see a podiatrist regularly for comprehensive foot care. If this information was helpful, please share it with someone you care about who is managing diabetes, whether that is a parent, partner, friend, or relative whose blood sugar has been difficult to control. Vital health information achieves its greatest impact when it spreads. I would also love to hear from you in the comments below. Let me know if you have a diabetes diagnosis, what daily foot care routines you currently follow, and if this discussion gave you new insights to share with your physician. The practical advice shared in the comment section helps far more people than you might realize. Your feet form the foundation that has supported you through every phase of your life. They walked you to school as a child, carried you across playgrounds, and brought you to your first job, your wedding, and the rooms where your children were born. They continue to carry you today. For anyone living with diabetes, the relationship with their feet must become far more intentional. The daily care they require is not optional. Proactive prevention is one of those vital acts of self-care that separates patients who avoid severe complications from those who suffer them. Take what you learned today, inspect your feet tonight, and commit to a daily checkup routine. Wear proper shoes, book a professional examination if you are overdue, and take any of the 10 signs seriously by consulting your doctor. The feet you protect today are the very feet that will carry you through the years ahead. Treat them with the care they deserve, and they will continue to serve you faithfully. Everything shared in this discussion is for educational purposes to help you better understand diabetic foot complications and know what to monitor in your personal care. Every patient is unique, and specific foot care strategies depend on individual factors that only your primary medical team can accurately evaluate. If you have diabetes and do not currently see a podiatrist or clinician who performs routine foot checks, please bring this up at your next appointment. Consistent professional care directly correlates with significantly better long-term health outcomes. If you spot any of the signs we discussed, especially open sores, indicators of infection, or marked changes in color or temperature, seek medical attention promptly. Foot issues in diabetic patients can escalate quickly, making early intervention the key factor in preventing permanent damage. Finally, if physical limitations make self-examination difficult, do not hesitate to ask a family member or caregiver for assistance. Daily monitoring is essential, and asking for help is a smart, proactive choice. Thank you for spending this time with me today, and thank you for taking the time to care for a part of your body that so many people ignore until trouble arises. Most importantly, thank you for looking honestly at the feet that have brought you this far. That informed, compassionate attention is the single best gift you can offer them for the journey ahead. Take care of yourself and take good care of your feet.